Alright, so super important vlog topic update. I just did a seminar on sensitive patient exams. So what's a sensitive patient exam? Encompasses the world of genitalia, would be the best way to describe it, and all of the diseases associated with such, and things that you're going to do on rotations, and things you're going to do in the real life and in the real world when you're a practicing physician, but could be super awkward for you or for the patient and aren't exactly the easiest subjects to talk about in the world, in life. So today we did a seminar from 7:30 until 7:30 until 1:30. So that's about 6 hours we spent today dealing with prostate exams, catheters, testicular exam, penile exam, pelvic exam in women, breast exam in women. I think that just kind of encompasses everything. So it was super cool the way it was done, and so I figured I'd share with you how it went. So we started out, and first they did show you videos of what to expect. Here's how you perform, a vaginal exam. Here's how you place it. Here's how to place the catheter. Here's how to do a prostate exam. Here's how to do testicular exam on your patients. So that was neat. I'm gonna turn my thing down so that my computer and my glasses. So that was a waste of time because they already showed those to us in class, and it was just another, it was just a waste of time. Then we went to seminars, where we got to practice putting catheters in mannequins. We did breast exams on mannequins. We all had to sit in the stirrups so we know how uncomfortable it can be for the patient who is getting a pelvic exam done. And we did breast exams on models. We did a vaginal exam with a speculum on a model, and we did prostate model exams. Not models, mannequins. This is all done on like a fake, medical licensed mannequin that's completely anatomical correct. So after that, we got to do the real thing. So today, I did my first vaginal spectal exam, and testicular exam, and penile exam, and hernia exam. We weren't allowed to do prostate exams on people or breast exams because for breast, I guess, it's simple enough. Or, I don't know, they just didn't feel us qualified. But we couldn't do a prostate exam because, what patient wants to sit there for 6 hours and have 15 people prodding up his prostate? It's just, it's not the most comfortable feeling in the world. So we did it on a mannequin, and we got to observe a prostate exam in real life, but we didn't get to do one. The testicular exam is fine because I'm a male, so, I've been doing them on myself for a while. Between ages of 15 and 35, if you're a guy watching this, start doing it because the highest risk is between males between 15 and 35. You fall in that category, once a month, you should start doing prostate self-exams. For women, I'm pretty sure what they told us is if you're over 40, you should start doing breast exams on your own every month. Pretty sure it's earlier than that, from your teenage years onward, but you should be getting them 40. No, I don't know. Statistics are ridiculous, but I just know that if you're a male, you're between 15 and 35, which I am, testicular exam. So testicular exam wasn't that hard to do, because, whatever. It's a dude, I'm a dude, we kind of figured it out. We did one on a standing patient and one on a patient who was lying down, because apparently there's two variations of them. Preferably I like the standing one because everything's just kind of there, everything's pushed out of the way. The lying down patient was a little bit more difficult to access everything, I guess, without going into too much detail about the patient. I guess that's the best way we could put it. Then we got to do the speculum exam on a real life vagina. It's awkward to say those words. It's still a little awkward to say words, but whatever. I'm fine with it. So that was an experience. The mannequin wasn't that bad because, it's designed for beginners. But then, in the real thing, it was 120% completely different. You can't recreate a real vagina in a mannequin to be anatomically correct. I guess anatomically correct, to have the same consistency, same texture, mucosal lining, I don't know. It was not what I was expecting. But I did a great job. I got satisfactory marks on my entire review. So we had to do that. We had to examine the cervix. We didn't get to do a pap smear because that's kind of suck. And I can imagine, the pain going into one pap smear as opposed to having, again, 15 medical students do one on you. but we don't know what we're doing. But my patient was awesome. She was fantastic. She was sassy. She was nice to us. She told us when things weren't exactly what they should have been doing. I loved her. Loved my patient. And then we checked for uterine distension, checked for ovaries. So yeah, so that was actually super hard. You know, finding the ovary was everyone's kind of hardest feature. But with patient guidance, you know, there was a nurse practitioner in the room. Mad props to the entire staff who did the event. I successfully completed my first vaginal speculum exam, which is a big deal. You know, not necessarily for testicular, because, you know, that's not, you know, it's something I do all the time because I have one, but to examine, you know, on a different level was kind of neat. But anyway, so that was it. You know, it's awkward to think about, and it's weird, you know, having it loom over your head and being like, okay, great, you know, today I have to do all these, you know, exams on real people. You know, but it all turned out to be okay. And it's a lot less intimidating, and it's a lot less gross, a lot less, you know, icky, a lot less, you know, uncomfortable than you would expect it to be. It is when you're talking about it, but when you're going through it and you're doing it, it's great. You know, if you have the right patient, I'm sure, which, you know, helped my situation. But awesome. Happy to be done with it. Happy I got it out of the way. And now I'm gonna like start doing stuff on all my friends. Be like, listen, we're gonna start examining your everything, but it's not gonna happen. Anyway, 7 minutes in. Thank you for listening. I just had an awesome experience, so I thought I would push it out to the world. Have a wonderful afternoon, or day, night, whatever it is where you're at. Leave comments below. Let me know if you want me to talk about something. All right. Have a good day.